Hello and welcome back to Focus Atlanta. Again, I am your host, Keisha Lanceland. Thanks so much for continuing to watch. In this segment, we're going to talk a little about kidney stones. I'm here with Dr. Winokur and Crystal Jefferson. Thank you both for coming on the show.
Thank you for having us.
Good morning.
Well, let's start at the beginning, Dr. Winokur. What are kidney stones?
Sure. So kidney stones are actual rocks. They are rocks formed from the minerals that are typically dissolved in your urine. And these stones will grow up in your kidney until they eventually move and then block the drainage of the kidney. And then you'll get potentially some pretty serious symptoms, things like severe pain in the flank, often described as the worst pain in the world. You can have blood in the urine, nausea, vomiting, and fever potentially, just to name a few. But it is worth noting that there are some stones that we detect incidentally up in the kidney before you get symptoms, and that may be caught on a CAT scan or a sonogram incidentally. And that gives us opportunity at times to treat the stones before you get those problems. These are extremely common. If our viewers have not had a stone themselves, I'm sure they know someone who's had a stone. And that's because 1 in 10 people will be affected by kidney stones in their lifetime, and it affects people of all ages and genders.
Crystal, can you tell me a little bit about your experience? Like, was there a question about what was going on? You didn't even really know you had kidney stones, or did you know that you had them and they were just inflamed or upset? Like, what was your personal experience?
I'm happy to tell you about my experience. I did wind up in the emergency room in 2009. I was in excruciating pain. I was vomiting. I passed the kidney stone. However, I developed additional kidney stones. My back started to bother me when I would stand up for long periods of time or when I drove for a long time. I knew something was wrong. I needed help. I sought out a specialist, Dr. Winokur, and Dr. Winokur went over with me all of my options because the stone that I had was, just to notice, one of those dangerous staghorn stones. And so Dr. Winokur offered me one option, the CVAC system, that I decided to select. And that was a game changer for me.
Well, Dr. Winokur, can we talk a little bit about what this, how this is a different option than some of the other options that perhaps Crystal and other people like her had been through in the past? What makes this option different?
Sure. So to put it in the context of those other options, which are all great minimally invasive options, they all work very well. The goal of them is to break up the stone, but you don't always remove the stones. We sometimes rely on the patient to pass those smaller fragments, and those fragments can be a major problem for patients. They can either grow bigger or cause those symptoms we refer to. Where the CVAC system really differentiates itself is that it's this all-in-one minimally invasive option that we can introduce up into the kidney. And once in the kidney, we can actually break up the stone effectively into small pieces, and at the same time also suction out or vacuum out all of those pieces that are being created to render the kidney free of any stone. And in that way, we've dramatically changed the outcomes of our patients while still doing this minimally invasively. And it's been a real game changer for me in my practice and for my patients.
Wow. I got to say, Crystal, the issue of having kidney stones seems so painful. But I got to say, this option seems a little painful too. Can we talk about what this was like for you?
Oh, it was an outpatient procedure. I did not have to be admitted to the hospital. I did take general anesthesia, and the procedure went as Dr. Winokur explained. I was a great candidate for it because my body did respond well to the CVAC tool. And after the procedure, I actually was able to stand for long periods of time. I could drive my daughter from New Jersey to Boston for college, take a long drive without any issue. So it went just as Dr. Winokur explained to me.
Wow. This could be such a game changer for people who suffer on a frequent basis with kidney stones. Is there a place where we can go and get more information?
Yeah, I mean, of course, you visit a healthcare provider or a urologist, but to your question, if you're looking for more information, there's a great website called surewithcvac.com that has great information, not just on the CVAC system, but kidney stones and treatment options in general.
Thank you both for making time for us here in Atlanta. It was a pleasure to meet you.
You
Thank you
too.
for your time.
Absolutely. All right. I think we all know, Dr. Winokur mentioned that we all know someone who has suffered with kidney stones, right? Please take the opportunity to go to the website, learn more if this, pertains to you and it's something is an option that might be available to you. Take the opportunity to learn more and stay tuned to more Focus Atlanta. We'll be right back.